Okay, I'm gonna do a little bit of a deep dive into what the evidence says and how we might approach conversations around the issue of vaccine hesitancy, which is just really a very small component of the whole issue of and all of those things that contribute to coverage. We, of course, as you know, we're sliding a little bit backwards, and I think looking at the last 12 years, I think you can see by 2018, at the end of that graph there, things had taken a wee bit of a dive after achieving so much. And also we'd really closed up the inequity gaps at the pinnacle of our achievements. And then when we come in the last 3 years or to the present time, you can see it hasn't improved, and it's sort of taken a downward trend, denoted by the dotted line, which is your total for the 6 month being fully immunised by 6 months. So that's a dive from 82% to 75% across 6 years. And of course, our inequity gaps have opened up, as I'm sure you're very well aware. So why is this happening? And of course, we've had this for some time now, the erosion of the support to public health and of course to primary care services that supports all the work that gets done in the space. And one of those things does also include addressing the issue of vaccine hesitancy, which of course has been a rising issue globally for quite some years, and is considered one of the greatest threats to public health and certainly the spread of misinformation. Vaccine hesitancy exists on a continuum where, of course, most people actually accept all vaccines. There's quite a high demand for them. Then you've got people who might cherry pick a little, accept some, and or delay or refuse some. And then there's the people who would throw themselves in front of a train before they would ever let a vaccine near their child. They will refuse all. And I suppose those at the far end of the spectrum you might call the anti-vaxxers. They might be people who are actively engaged in distributing misinformation. But by and large, most people don't fall into that category. They might just have a low confidence. They might have some concerns. It's not easy because that's a very heterogeneous group. They have a whole lot of different reasons for having some concerns or not accessing the services, assuming that the services are accessible to them. So I guess at the moment, I mean, we're in really, really interesting times, and you are really up against a vaccine misinfodemic of unprecedented magnitude that bathes new parents daily in torrents of scare stories, conspiracy theories and misinformation. And people don't have to go out doing their own research in order to be bathed in this information. So this is something that can really fuel vaccine hesitancy. I guess, there's some nice evidence-based strategies for clinical organisations, and I guess they tend to fall into three main groups: organisational level, interpersonal and individual level interventions that all contribute to the reduction of hesitancies. There's things like point of care prompts and reminders and recalls, of course, that you can set up and do well. There's the recommendation of clinicians is incredibly important. It consistently, shows how important that is. And also having that confidence and that sort of using a presumptive announcement style language, like so we're going to book your vaccinations in, and that sort of language, just assuming that people are going to be wanting to do it. And then we get into the individual level interventions. So making sure, and I think, I think we could have done better in this space over the last few years, and that is, really providing more assistance, more timely information to providers, and also providing more resources for providers to help address some of this vaccine hesitancy. And then when you're talking with at that individual level with parents is the way that messages can be framed, addressing patient barriers, and also how you can, and this is what I'm going to just dive into, using effective approaches for countering misinformation. So these are some examples from, this is on COVID, but I think it's perfectly applicable here because it just highlights who we're going to be perhaps thinking about having conversations with. This is from Horizon Research from December 2020, who've been tracking opinions and attitudes around COVID and COVID vaccines. So I think you can see just by these quotes here that really it's probably not going to be helpful to be trying to do any myth busting or anything with people who feel and have these sentiments, because first of all, before you even have a conversation, you're going to have to be building some trust up, and that's probably a whole nother conversation. So that's probably not where you're going to be targeting your energy, but there might be some more opportunity here where you can see from these quotes here that these people might be prepared to engage in a conversation. They might have been bathed in some of this misinformation, and of course have some concerns that have arisen as a result of that. So this hesitancy has and how you communicate has been defined or described, should I say, I guess, as a wicked problem, because it is really hard to define it. There's no quick fix, perhaps, and there isn't a complete consensus on how to communicate about vaccines. And that's probably when you go back to that group that aren't completely confident about this. They're really, really heterogeneous. There is no one size fits all. And I think sometimes when we're trying to make one size fits all, we really don't serve anybody very well. And I think there's a nice little survey here from Canada, which actually went to parents and they asked the parents about what they thought about messaging. And messages, and this is what the parents thought, messages should emphasise the scientific evidence showing vaccines have are very safe and are very effective at reducing the illnesses. Emphasise perhaps the risks about the disease, about catching the disease, is really important. Don't shame. I know that's a no-brainer, isn't it? But don't try to persuade people based on some moral duty. Vividly detail the negative effects of childhood diseases. Why would you vaccinate against something that you don't know exists, or you don't know what it is? Why would you do this? So they highlight that as being really important. And also encouraging parents to, encouraging that vaccines are strongly recommended. This is what, this is what the body of clinicians and providers recommend. Participants were also asked to suggest other approaches, and one of the most cited recommendations was the use of research to debunk myths. So they found that debunking was important. However, when they talked to the parents who had strongly vaccine hesitant views, perhaps they're also sort of more anti-vaccine, they were more focused on showing compassion and communicating honestly about risks. So they obviously feel, you can see there's a huge lack of trust there, and I come back to the fact that you've got to build that trust up before you can have a meaningful conversation about the details, I guess. But I thought that was really helpful to sort of a helpful survey and actually asking parents what they thought. So we can work with the basics, and we go right back to the art of persuasion, or back to Aristotle here. It's not rocket science. You've got to have a good argument with some data, with the logic, the logos, trustworthy messenger, and also the messenger, you have to be attentive to the needs of your particular audience, because as I said, they're also very different. And when you're thinking about trying to address people with perhaps a bit of conspirational thinking, these two things here are going to be extremely important. There is some a growing body of research that shows that if you inoculate people before they receive misinformation, it can help them be more resistant, which is very elegant concept when it comes to vaccines. And of course, you don't always have the opportunity to do this, but if you do foresee a situation and you can see this misinformation coming a mile away, sometimes you might get the opportunity to actually prepare people for hearing misinformation, and you're able to highlight the ways in which this information is wrong and has been distorted. So there are guidelines and tips for doing that. So there is a bit of, I think, confusion and a little bit of, different thinking about should you refute misinformation or will it just make stuff worse? And I think there's really quite a solid body of evidence now about the space, evidence for correcting misinformation. This is really useful, this little handbook here. It's got really big font, it's got lots of diagrams and pictures, which makes it really easy for very busy people who don't have time to dive into the literature. It's all there if you want it. But it's developed to be easy to use. And it's quite thin, not too many pages, but a lot has gone into it. And just to show you this little graphic shows you about the potential for the backfire effect, or if you debunk something, it might make it more familiar, but actually shows you the overall net gain. The debunking usually overpowers the increase in familiarity. So if you see the little M, the little boxes with the myth being presented repeatedly, and the familiarity grows. But when you come along and effectively just debunk something, it can overwhelm that, and you can actually have a net gain in terms of somebody's understanding of it. Like I said, it's got great little graphics, and it's probably more successful if you apply 3 or 4 components. But there's a general kind of, formula, and formulas are quite nice to be able to follow, where you lead with a fact, you warn about the myth, explain why it's wrong, and then finish with a fact. So I've just got a little example here for you where perhaps you might want to, if somebody has concerns about MMR vaccine, of which I'm sure you've seen a few of those before. Measles can be a serious disease and can leave lasting problems. Vaccination's a very effective way to prevent it. So you're leading with a fact. A common vaccine myth, you've flagged that this is a myth, is that there are toxic ingredients in the vaccine. But this argument ignores the fact there are no toxic levels of any substance in vaccines. It plays on people's irrational fear of chemicals. Any substance, including water, can be toxic in a high enough quantity. I mean, you probably think of something better than that, but it's an example. And then finish with the scientific consensus, and that there are many decades of research and studies that include millions of people that show that vaccine is very safe. I always say very safe because there's nothing absolute. Of course, there are always risks. Serious side effects are extremely rare, and if vaccines caused, insert your thing here, we would expect to see more cases in vaccinated people, which we do not, for example. So just to finish, correcting information can be a vital part of the dissemination of truth. We've got quite a lot of evidence now to show not only that it's important, but also how to do it effectively, and to try and avoid adding to that kind of overall potential backfire effect or driving people away. And also corrections can be more helpful when you're talking about health-related topics. And you should always include a retraction as well as an alternative explanation, but alternative explanations are important. So I guess to conclude, that vaccine coverage has been taking a wee dive for a whole lot of reasons. I'm sure most of you are very close to some of those. And hesitancy is just one important factor in the failure to vaccinate, and it exists on a continuum which requires all of these complex, multifaceted strategies. It's fueled by misinformation, and it's really, I guess we're facing some very challenging times in that space right now. But a trusted source can make a huge difference, and there are some really good now evidence ways to approach these conversations. So thank you.